It's another wonderful sunny day in beautiful Scottsdale, Arizona, and we are at the Slice is Right podcast with Dr. Aldo Guerra.
And I'm Dr. Scott Ogley. Thanks for joining us, everybody.
There he is, and I'll tell you a little secret. We did Juven last week, and he hasn't stopped.
I just can't
drinking
get enough.
it.
I feel so much better. It's just like it tanks up my, it tanks me up.
He's also going to the gym every day now. Have you noticed any more muscle? Have you noticed any
I've
muscle?
been flexing the whole time. I hope somebody noticed.
I don't think he knows there's only 2.5 grams of protein in there. So,
but other good nutrients nonetheless.
yes, he's getting a lot of zinc, guys.
Yes,
a lot of
lots
zinc.
of zinc.
Very important.
Exactly.
But we're happy to be back here. We're going to be talking about plastic surgery today. We're going to be talking about a topic that we get a lot of questions, and that is how do you do your muscle repairs? And what are my options?
Mm-hmm.
Yeah.
Yes.
So we're talking about tummy tuck. He said it. Yeah, and he's right. So with tummy tuck, there's a condition that happens after having a baby, and it's called a rectus diastasis. And Dr. Ogley here is going to go over the anatomy for us. So let's have you do it.
So this is a good demonstration of how anatomy changes after pregnancy, namely that photo on the left, showing the midline between the two ab muscles that splits the belly button. That midline stretches, and the ab muscles become more stretched apart. That's called the linea alba. And so with any muscle repair, what we do with that is we return it to normal anatomy, return it to the pre-pregnancy body by suturing those ab muscles back together. And you can see that change from left to right, where now there's not a gap between the muscles. The abdominal core is stronger, tighter, and flatter, which is what patients are looking for.
Yeah, that sounds great. That's a great little summarization of the abdominal anatomy. So, you know what patients call that? They call it the pooch, right? They don't know that it's a stretched out linea alba. Linea alba means white line. So, you know, when you do the dissection, it looks white in the center there. On the other side of the rectus muscles, on the lateral side, is the linea semilunaris.
Mm-hmm.
And what we try to actually do when we repair the muscles is get all that abdominal wall that's coming forward in the pooch back towards the linea semilunaris, which doesn't stretch as much. It can stretch a little bit on some people, but not as much. But that underlying anatomy cannot be changed via exercise.
No, it cannot. Yeah, it's just stretch. It's every time there is a pregnancy, it stretches a little bit more apart and returns a little bit less toward the center. So multiple pregnancies, large births,
Right.
twins will create a worse problem and require often a larger repair.
How about 3 or 4 kids at the same time?
Oh, I haven't seen one of those yet, but I imagine that stretch would be quite large.
Yeah, I've seen a few. I've seen a couple over the last 20 years where
Yeah.
they've had 3 or 4 kids. And
Oh, at the same time?
yes, yeah, exactly.
Oh, wow.
Yeah, you know,
Okay.
IVF. There's a lot of IVF
Yeah.
in Scottsdale, and that's happened to some people. Now, when we're thinking about repairing the diastasis, there's some key components that we want to take into consideration, and that's, you know, how much are we going to repair, and what kind of suturing is required, and all of this is done with sutures. So that's why, as I mentioned earlier, you can't really change this anatomy with exercise. You have to have it surgically repaired, surgically changed back to where it was before babies. And so, what do you like to use, permanent or sutures that go away?
I tend to prefer, I've seen both, I've learned both, but I tend to use permanent sutures because I just like the security that they will always be there. They'll always be doing some sort of repair and holding, even though eventually your body kind of takes over that and scars on its own and takes over the strength of that suturing.
Right. So you guys may already know that Dr. Ogley did an aesthetic fellowship, and when you do that kind of fellowship, you see like 14 tummy tucks a day.
Yeah.
20 breast dogs a day. It's a mecca of breast augmentation where he was at, and a mecca of tummy tucks. And so you would see different physicians, as you mentioned, use
Doing it different ways, exactly.
And what I'll tell you, what I'll tell you about that is, right, there's no right way to completely do it. I think there's things that you get really comfortable with and you prefer, and there's pros and cons. And some sutures are more problematic than others, right? And so when I first started, I've always used permanent suture. I don't really believe in absorbable or sutures for muscle repair, but I used to use a big proline, and we were talking about this earlier. And with the big proline, sometimes the knots that you tie are pretty noticeable. You can feel them on the skin, and once or twice in 20 years, I've had a little bit of a piece of that proline show through the skin, and it required removal later. So I stopped using proline, and I used this very nice, soft permanent suture, which I love. They're smaller. They're not zero proline like in the old days. They're more like 2O ethibonds. And it's you tell them a little bit about what the characteristic of the ethibond is like.
Yeah, it's the same suture that I use for my muscle repair. It's permanent. It's braided. It's a green suture, and it's softer, so it can hide a little bit better. It still holds just as strong as any other suture you might have used in the past, but you're not going to feel it. It's just going to do the job it's there to do and not cause other issues.
Right. Now, to be perfectly fair, I've used absorbable suture in my really tiny patients. And what I mean by that is I take a look at their body mass index. If it's less than 18, tiny. You can't find it. These are the types of patients that you can't find any fat to lipo. They're so thin. It's just all muscle and skin. And they have beautiful results with tummy tuck. But I think absorbable sutures might be the one place in that situation where I feel really comfortable using, so that it goes away and the repair is good. Mm-hmm. Let's talk a little bit about other things that can happen in the abdominal wall, right? Like hernias.
Hernias, yeah.
How common do you think you see a hernia in clinic?
Probably 5 to 10% of the time, there's a small little hernia around the belly button.
Yeah.
Whether it's noticeable, and sometimes you don't appreciate it until you're in surgery, and there might be a very, very tiny one. But it's a lot more common than people might realize.
Yeah, and we repair those hernias all the time.
Yeah.
We, as plastic surgeons, we do the umbilical hernia repairs and hernias above the umbilicus all the time. What we don't do is the inguinal hernias. Those are the ones that are down by the groin, and those are really a general surgery type of specialty that would help you with that. Maybe even use a mesh for that. We typically will do suture repair of small hernias, which is a very acceptable and appropriate way to treat those.
Correct.
Rule number 1 is fix the hernia, then you can do the diastasis repair.
Yep.
Okay. Let's talk a little bit about... actually, you know what? Let's show this video. Let's have our staff here pull up that video so you guys can see what we're talking about here. Yeah. So there's the hernia. There's the umbilical diastasis, and it's already been repaired from the umbilicus above. It's nice and tight. You can see that I've marked her out to do another layer on top of that repair. All right, now let's look at this video. We're going to play this. This is actually the diastasis before the repair. What do you think about that diastasis?
Yeah, it's pretty significant. Looks to be at least 6 to 8 centimeters across, and no doubt that person would have had quite a big pooch, as we called it, prior to the surgery.
Right. So it's definitely one of the widest types of diastasis, but you can see how those muscles move with the suturing, right? And that's just one suture. So I'll put about 20 of those little sutures in the abdominal wall. Those are what we call interrupted sutures, and then we'll run a stronger suture on top of that so we can get a really rock-solid repair. So, patients worry that if they lift something in the first 6 weeks, it might rupture, but yeah, maybe you could hurt one of the sutures, but you're not going to hurt all those other 20 sutures that are in there. You're going to be A-okay. Yeah,
I do the same for insurance. You have a bunch of interrupteds and then a running on top of it. So if something fails, there's a fail-safe so that it's not clinically relevant and it doesn't cause problems for the patient.
Now, another thing that patients should know that we offer is we offer an opportunity to manipulate the abdominal wall with some corset sutures, which makes it look afterwards like you have a nicer hourglass shape, a nicer waistline. The corset technique is what I call it. How do you like that, Scott?
Yeah, I mean, it just adds that it's like a plication on steroids. Not only does it take the central part of the abdomen that's widened, it plicates and kind of folds over and tightens stuff that's outside of that to get a little bit more snatching of the waistline.
That's a really good word, snatching.
Snatched, yeah.
So snatching can be accomplished via liposuction, but also that moving that abdominal wall laterally really gets you a nice, cute curve, and it works very nicely. It takes some experience to do it. One concern that I had early on was, where my patient's going to feel more pain if we did this muscular snatch. And what I found out with Exparel is that it does not increase the level of pain. It does not increase the number of pain pills that they take. So there's a picture of Exparel on the screen. It's a local anesthesia that lasts 4 days, right?
Yes.
So everybody has that experience where they go to the dentist and they get 2 hours and then they
Maybe
start feeling the pain.
Yep.
Here we got 96 hours of pain relief. And studies show 50% reduction in the overall number of pain pills that a patient might use after a tummy tuck. It's really wonderful.
And we used it on every single patient that we do muscle repair on. We used it on. It's we don't compromise on that because we found much better pain control. And with patients with better pain control, they're more likely to get up and move, and less likely to have other complications because of that mobility, like blood clots. Yeah.
So one of the things that we want to make everybody aware too is we have some promotions that are still going on. The bikini summer bikini promotion is still happening, going through April. It's going to run out here pretty soon. So go to myfaceandbody.com, sign up for that. And the photo challenge, I think your patient last month in April won.
Yep, and we're still
in March. Right?
In March, we're still doing the April photo challenge. So patients can go and tag our main office Instagram account, AZ Breasts, on Instagram there, and enter to win a $100 Victoria's Secret gift card for this month of April.
That's pretty nice. I think that's a really great gift.
Yeah.
Hopefully you enjoyed our quick little demonstration on rectus diastasis repair. Let's not let anybody have a pooch there that they don't want. And then we're going to present the case of the week, and this is perfect for this.
Yeah.
And this is Dr. Ogley's case. He's been doing some amazing work, lovely results. Tell us a little bit about this patient.
Yeah, so this patient, a very classic patient that comes looking for tummy tuck surgery. She's in her early 40s and was displeased with her muscle separation, loose skin on the lower part of her abdomen. So what we did was we removed that excess skin, but I think more importantly for her even than the excess skin was that muscle repair. And you could see from the side there that much flatter abdomen because now her muscles are back to the center. They're back where they were pre-children and looking like younger and better than ever.
Yeah, no, I agree. If I had that patient in clinic, I would think she's a very ideal candidate for a tummy tuck. You can definitely see, even without having the opportunity to examine her, that there's a diastasis there. Mm-hmm. It's significant. It's primarily below the belly button. And of course, I see that you did some liposuction as well. Tell me a little bit about the lipo that you did with the tummy there.
Yeah, typically I will pair most tummy tucks with liposuction of the flanks, the back, and the bra line. I just think that treating the entire torso makes sense. It treats the whole unit. There's not any awkward starting and stopping points. So with her, I did that entirety of it to make it look as good as possible.
Well, I would say that incorporating liposuction in a tummy tuck gave her like an exclamation point. She looks amazing.
Yeah, thank you.
Tell me a little bit about the liposuction over the abdominal flap. Do you do much there?
I tend not to do much liposuction along the abdominal flap because of the risk that it can reduce for wounds. We're all about, like Elastic talking about Juven to help prevent wounds and to help heal properly. I don't want to create wounds. And how you do that is by liposuctioning the abdominal flap. So we tend to stay away from that area, just liposuction the areas like the flanks and the back, and save that for later if it's needed.
Okay. Yeah, very good. Yeah, I believe in a little bit of liposuction there, but we're very cautious. Both of us are very cautious. We want to make sure the patient has the best outcome. Yeah. We always have the best intentions in mind as well with regards to liposuction. But I do think the modern tummy tuck incorporates liposuction much more than when I started training 25 years ago, where basically liposuction with a tummy tuck was unheard of. And so thank goodness we've progressed.
Yes.
Thank goodness we know the anatomy. Yeah, absolutely. We know the anatomy much better to keep it safe. So all of you out there who are paying attention, thank you for your time. And we will make sure that we keep you safe and we give you the best outcome with the procedures that we do. So give us a ring whenever you're ready. Appreciate you.
Thank you, everybody.
Whole life's ahead of you. Can't waste it probing